Dr. Kesselheim, according to Medicare and Medicaid data, between July 2013 and June 2014, at least 1,200 generic drugs more than doubled in price. Are you aware of this?
Yes.
There's one generic drug called naloxone that can reverse the effects of opioid or heroin overdose in just a few minutes. It has become vitally important for first responders, law enforcement, and healthcare workers. According to the CDC, heroin-related overdoses nearly quadrupled over the last decade. And yet, the company that makes naloxone in the nasal formula, most commonly used by first responders, increased its prices across the country by more than 50% over the past year. In Baltimore, where I live, the cost of naloxone more than doubled in less than 1 year. Dr. Kesselman, are you aware of these price hikes?
Yes.
The only explanation for these price increases seems to be that this company sees the increase in demand for naloxone, and it sees the lack of competition, and is increasing its prices to make additional profits. This year I introduced the Medicaid Generic Drug Price Fairness Act. This bill would require generic drug manufacturers to pay rebates to state Medicaid programs when drug prices increase faster than inflation. Under the current law, brand name drugs already pay these rebates. My bill would simply extend the same requirement to generic drugs so that they are treated equally. The Nonpartisan Congressional Budget Office estimates that this change would save taxpayers $1 billion over the 10 years. Do you think this proposal makes any sense?
Well, first of all, absolutely. I think it's great that we're talking about generic drugs at a meeting on innovation, because one of the key principles towards drug innovation is that, sure, we need a period of market exclusivity in which a brand name company can make back its invested revenue, but what really drives innovation is when that market exclusivity period ends and then there is generic drugs available on the market and a vibrant generic drug marketplace in order to compete with the brand name companies, and that forces them to then pursue the next great thing. And in this case, it seems like there's a major market failure in the case of being able to provide these generic drugs for reasonable prices, and we need substantial attention to this particular case, the naloxone case, as well as the many other cases that I know you've looked into and that others have looked into about generic drugs that have been increasing in price. And I think that your bill is a good step in the right direction, but I think there are a lot of also other things that could be done to try to make sure that there is a vibrant generic drug marketplace to try to promote innovation in both brand name and generic.
A lot of people don't realize it, Dr. Kesselheim, but there are hospitals, according to the American Hospital Association, over 90% of all hospitals are suffering from drug shortages. And a lot of this is that folks are hoarding drugs and then jacking up the price, and selling it over and over again, and creating situations where a lot of hospitals cannot get first-rate drugs. Are you aware of that?
I am. It's very wasteful. A lot of these drugs are old drugs. There's no intellectual property covering them. This is a problem of the lack of attention that I think that our society has spent on on making sure that there's a vibrant generic drug market, and policies that can help ensure that these kinds of shortages are addressed in a timely fashion. I think the FDA has taken some steps internally in it, but I think that they could use a lot more attention and resources like the kind that you're trying to bring to it.
Well, I can tell you, we're going to continue to shine a spotlight on this, but because again, going back to this project that Senator Warren and I are involved in, we're trying to figure out how do the middle class and others keep more of their paychecks. They're paying more and more for the basics of life, yet and producing more, but yet and still they're not getting paid more. And then they see the paycheck that they're getting shrinking, and they don't know. They're trying to figure out how to make ends meet, and they can't see a future even for their children. And that is a future where their children do better than what they did. And so, again, it's all a part. It's so amazing how all of this comes together and how every aspect, again, is hitting that middle class over and over again. And I've got to tell you, people are tired. And many of them are throwing up their hands, trying to figure out what can we do to make their lives better. And this is an effort in that regard. Senator Warren?
So I just